Respiratory. Oxygen. Class, gas. Action, odorless, tasteless, colorless gas that is present in room air at 21% concentration. Oxygen enters the body through the respiratory system and is transported to the body tissues for energy, used to reverse hypoxemia, and in doing so, helps oxidize glucose to produce adenosine triphosphate, metabolic energy. Indications: hypoxia, hypoperfusion, ischemic chest pain, respiratory insufficiency, suspected stroke, confirmed/suspected carbon monoxide poisoning, cardiac insufficiency, or arrest. Contraindications: none pre-hospital. Onset duration: onset immediate, duration less than 2 minutes. Dose and route: adult 1 to 6 liters per minute via nasal cannula and 10 to 15 liters per minute via non-rebreather. Peds, same dosage but using appropriate sized masks. Albuterol Proventil. Class: sympathomimetic, bronchodilator, beta-2 agonist. Action: sympathomimetic that is selective for beta-2 adrenergic receptors, relaxes smooth muscle of the bronchial tree and peripheral vasculature by stimulating adrenergic receptors of parasympathetic sympathetic nervous system. Indications: asthma, anaphylaxis, bronchospasms, reversible obstructive airway disease, hyperkalemia. Contraindications: caution with patients with cardiac dysrhythmias. Onset duration: onset 5 to 8 minutes, duration 2 to 6 hours. Dose and route: adult and peds, 2.5 milligrams diluted in 3 milliliters of saline. Repeat as needed. Ipratropium, Atrovent. Class: anticholinergic, bronchodilator. Action: blocks interaction of acetylcholine at receptor sites on bronchial smooth muscle, resulting in bronchodilation, reduced mucus production, and decreased levels of cyclic guanosine monophosphate. Indications: persistent bronchospasms, asthma, COPD exacerbation. Contraindications: hypersensitivity to atropine. Onset duration: onset less than 15 minutes, duration 2 to 4 hours. Dose and route: adult 0.5 milligrams diluted in 2.5 milligrams in S via nebulizer. May repeat dose twice per most protocols. Peds: 250 to 500 micrograms diluted in 2.5 milligram saline via nebulizer every 20 minutes up to 3 doses. Epinephrine, racemic micronephrine. Class: sympathomimetic. Racemic epinephrine is an inhaled version of epinephrine that is used as a bronchodilator and as an anti-inflammatory to treat laryngeal and tracheal swelling and edema. Its actions are the same as epinephrine, but since it is an inhaled version, it has both systemic and localized effects. Indications: croup, asthma, bronchospasms, laryngeal edema. Contraindications: hypertension, epiglottitis. Use caution with known cardiovascular disease or patients above 45 years old. Onset duration: 5 minutes. Onset 5 minutes, duration 1 to 3 hours. Dose and route: adult 0.5 milliliters 2.25% diluted in 3 milliliter NS. Peds. All doses given in aerosolized neb. Less than 6 months is 0.25 milliliters, 2.25% diluted in 3 milliliter NS. Above 6 months is 0.5 milliliters, 2.25% diluted in 3 milliliters NS. Methylprednisolone, Solu-Medrol. Class: corticosteroid, glucocorticoid. Action: synthetic steroid that suppresses acute and chronic inflammation. It also potentiates vascular smooth muscle relaxation by beta-adrenergic agonists and may alter airway hyperactivity. Indications: anaphylaxis, asthma unresponsive to bronchodilators, and adrenal insufficiency. Contraindications: caution in patients with GI bleeding, diabetes, and severe infection. Onset 1 to 2 hours, duration 8 to 24 hours. Dose and route: adult 2 milligrams per kilogram, max of 125 milligrams IV. Peds 1 to 2 milligrams per kilogram, max of 60 milligrams IV. Diphenhydramine, Benadryl. Class: antihistamine. Action: blocks histamine H1 receptor sites, thereby inhibiting actions of histamine release. Indications: allergic reactions, anaphylaxis, acute extrapyramidal reaction, dystonia. Contraindications: patients taking MAO inhibitors, caution with narrow angle glaucoma, and newborns and nursing mothers. Onset duration: onset 5 to 15 minutes with max effects in 1 to 3 hours. Duration 6 to 12 hours. Dose and route: adult 25 to 50 milligrams IV IM PO with max of 400 milligrams per day. Peds 1 milligram per kilogram IV IO PO with max of 300 milligrams per day.